Good morning. Today we wanted to spend some time with the newest member of the Glidewell clinical team, Dr. Darrin Wiederhold, as well as talk about some of the projects and technologies we've been working on here at the laboratory. So with that, I'd like to introduce Dr. Darrin Wiederhold. Darrin, can you tell us a little bit about yourself?
Sure, I'd be happy to. Originally from the East Coast, Pennsylvania boy. When I was younger, my dad worked for the federal government, so I had an opportunity to travel throughout my childhood. Even had the opportunity to actually live and or visit 6 out of the 7 continents. The last I haven't made it to yet is Antarctica, but being kind of a lover of the sun, I don't really see myself heading that way anytime soon. But when I graduated from high school in Indonesia, I came back to Pennsylvania, went to college up in University Park, and then Temple Dental School down in Philadelphia for dental school. And when I finished dental school, I had already started to get some experience with implants. I had become interested in surgery, particularly during dental school. And so I started to take some courses, even during dental school, to prepare me for possibly placing implants, whether it was as a restorative dentist or ultimately as an oral surgeon. So I became very interested in surgery at that point. And I was about 99% sure that I wanted to do oral surgery when I got out, but I wanted to make 100% sure before I made that commitment. So I enrolled in a GPR program up in Buffalo that was had an extensive component for oral surgery. I got a chance to do a lot of trauma and even some exposure early on to some implants there, and kind of decided, yeah, that was absolutely what I wanted to do. So I applied and was into an oral surgery residency program in the University of Kentucky in Lexington. Was there for a year, had just finished my intern year, and had, for some personal reasons, had to withdraw from the program. And then took some time off, and about 2 years later, came back and did a second year at GPR down in Kentucky as their chief resident. So kind of got an opportunity to get about 3 years of additional training after dental school in surgery.
Brings up a really interesting question, because there's a lot of interest with general dentists on starting to place implants. And I think just like doing any other kind of procedure, whether it's for taking out wisdom teeth or doing root canals or ortho, whatever it is, that you have to make sure you're well trained and confident and competent before you start doing it. Now, they don't necessarily have to go through 2 GPRs in the first year of an oral surgery residency to do that, but what are your thoughts as far as what a general dentist should do as far as preparing himself to start placing implants?
Well, I would say, the first thing, certainly, as you said, I don't know that they necessarily need that additional training, but you do want to, more so than just a weekend course. You really want to take a comprehensive course that's going to expose you to bone physiology, make sure that you're familiar with all the implant terminology, allow you to, if at all possible, do some live surgeries, get your hands wet as much as possible, really develop your treatment planning skills, become proficient in those aspects, work as much as you can, take a course.
And there's some excellent ones out there. I think
Absolutely.
we were talking earlier with the Mish Institute. There's Maxi courses. There's the A to Z course at UCLA with Sasha Jovanovic is a great course. So these are more the longer term programs.
Absolutely, and certainly if you have the opportunity and you can invest in the year-long courses, it's essentially you can't get enough education, I would say, is the take-home message. But you want to get those fundamentals. You really want to be proficient beyond just having a good sense of your surgical skills and, again, the bone morphology and the anatomy in that area. A great review for anatomy course would be certainly a critical component. Beyond that, though, I would say managing cases post-operatively. You hope that every case that you do is going to be a slam dunk and is not going to have an issue. But certainly complications can arise, and the more cases that you do, it's inevitable that you are going to encounter some of those, challenges and those difficulties. So if you can not only become proficient, try to minimize those complications, but when they do arise, have a good sense of how you're going to handle it, keep level-headed during the surgery if you do encounter a problem, and anything that comes up after the fact, certainly, if you have a solid foundation to draw from, that you help, a few less sleepless nights, I would say.
Right, how to manage them, or even better, how to avoid them if you know that
Absolutely,
ahead of
if
time.
at all possible.
And then the other thing, as far as recommendations for a general dentist, would be want to be a mentor, and maybe you can.
Sure, absolutely. If you have the opportunity to shadow someone, whether it is an oral surgeon or a periodontist or just a general dentist who has extensive experience placing implants, if you can shadow them in their office, watch them, have them with you while you're doing several of your cases. And I would say the number one thing would be, case selection would be want to make sure that those first few cases that you do are what you would consider the ideal and the ones that are going to be the most straightforward and are really going to, hopefully present you with the least amount of challenges. So you can develop your skills, develop your confidence and your competence. And if you have that safety net in place of having a mentor or a shadow, or that's someone that you can shadow in place, it certainly makes the process a lot easier.
And then, okay, so we got correct amount of education, find a mentor to help you, and then the third edge you mentioned was finding those first ideal cases. Absolutely. So if what would you recommend is what's the ideal first cases a clinician should be looking for? I
would say absolutely a maxillary first premolar. It affords all the surgical challenges that come with you know, the maxilla, whether it be the sinus or avoiding adjacent teeth. It allows you to work in the less denser bone, so it's a little less forgiving. You have to be a little more, you know, proficient with it. But and again, it gives you the aesthetic challenges that an anterior tooth would provide, given that it's as close to the front as it is there. So if you can round up, you know, a good dozen or 2 dozen maxillary first premolars out of the gate, really get your hands wet. Repetition is the key, I would say. You know, just if it seems like they're getting too easy, that's a good sign. Mm-hmm. You know, it means that you're developing your skills, you're starting to become comfortable with that, and you know, once you really get that true sense of confidence in yourself, and the cases are going well, then it might be time to branch out, you know, to maybe an anterior tooth or ultimately more a mole or something cases. Like that. But you know, you really can't put a number on how many you really want to do. But the more you can do of the quote-unquote straightforward cases, I think certainly is going to go a long way to increasing your chances for success. Right, and I think that goes back to a key, going back to the mentor and tying those together, is having that surgical backup of what cases are you comfortable with and which ones should you refer out. Absolutely. And absolutely, in that way also, if you run into a problem, you've got somebody that has your back as far as helping you through those cases. Yeah, I mean, I think the thing that you gain most from experience is the ability to recognize when you're in over your head a little bit, perhaps. You know, there are people out there that have, you know, are great at it and have an innate natural instinct for it and can take right to it. But you know, every day someone runs into a challenge that they either haven't experienced before, so they're a little uncomfortable handling it, or you know, it's just something that they just would rather not deal with the headaches of. And so I think that, you know, recognizing that it's a case that should be referred, there's no shame in admitting that, you know, the case is a little challenging, and certainly anyone who's out there who has that experience and who feels comfortable handling those situations only got that way by having gone through that themselves. You know, they've been in the same situation that you are. So there's no reason to feel that, you know, it's a knock against you as a surgeon in any way. It's just, you know, recognizing that, okay, I haven't seen this before more than anything, and how am I going to handle it? And part of your learning curve. Absolutely. All right. Okay, very good. So one of the main things you've been doing since you joined us, you placed a large number of implants, but you've been working with us as far as placing the inclusive implants. So maybe you can tell us a little bit about what you think of that system. Sure. I think it's a great system. You know, it has all the advantages of the time-tested, proven implants of old. The internal hex, again, being the most popular system out there in dentistry by far. It's got a great thread design that maximizes your initial stability in that area and helps promote osseointegration. It's intuitively very easy to use. Again, anyone who's had any experience with any of the larger systems out there is going to be very, very comfortable and is going to be able to transition into the inclusive implant very easily, I think. Mm-hmm. And I think a key, it's a great system put together by a very experienced team. We have a lot of engineers and technicians that actually came from the implant industry, but I think the key with being the first laboratory to introduce an implant system is that we can encompass a full package. We can help everything from planning the case to the final restoration. So I think that's a major differentiator. So maybe, you know, that leads into one of the major projects we've been working on, which is the inclusive tooth replacement solution. So maybe you can tell us a little bit about that. Sure. As you mentioned earlier, it's basically a comprehensive package that has the full Glidewell expertise and experience behind it. In addition to the implant up front, the dentist receives a prosthetic guide, a custom healing abutment to allow early contouring of the soft tissue immediately, a matching custom abutment ultimately down the road for the final prosthesis, an impression coping that's matched to that same soft tissue contouring. So the entire process from start to finish, from the placement to the restoration, is guided, very predictable, very optimal in terms of improving your chances of success. So it's just a wonderful comprehensive package that you know, you have laid out right before you even get started. So I think it's it's going to be folks are really going to take to it, I think.
Right, and I think a core to this, the solution is the section of which the versatility of it is. At implant placement, you'll have pre-surgically have made for you custom healing abutment, custom temporary abutment with a biotemps crown, and a matching impression coping. So I think that the thing here is I think there's something for everybody, from a surgical specialist, if he has a restorative-driven surgical practice, that he can start sculpting those soft tissues correctly for his, so it'll be easier for his restorative dentist. He can either immediately provisionalize it, or he can put the healing abutment on it, and then later he can send that custom impression coping to his restorative dentist, and then they can now transfer those contours correctly to the laboratory, which is one of the biggest challenges we have as people using raw impression copings and then trying to make an anatomically shaped tooth. So I think that's a core to this system. So maybe you can expand a little bit on that.
Sure. As you were saying, I think for those general practitioners who are doing both the surgery and the restorative, certainly it's a comprehensive package that you have available to you. If you are a specialist and you're looking to develop your referral base, certainly if you have that advantage of being able to, communicate to your general practitioner, I'm not only going to place the implant for you, I'm going to start the restorative process for you. I'm going to place a healing abutment that is going to begin to contour the soft tissue for you to make your life much easier down the road, and predictably, and something that can easily be reproduced. Then the components can, of course, the additional components can be forwarded to the restorative dentist, as you mentioned, and they can, when the time comes, place the custom abutment that matches that profile, that emergence profile that's been developed. So there's just predictability, a great sense of continuity there, and it's a great builder for referral base, certainly for specialists who want to help out along the process beyond just placing the implants.
And then ultimately, the final restoration, which is a superior restoration, therefore a better patient care.
Absolutely.
Okay. So then, other technologies we maybe walk into now is other things we've been working with is guided surgery. So maybe you can tell what your background was before and what your experience has been now that you've started working with digital treatment planning and guided surgery.
Sure. I've been doing guided surgery for about 6 months since I came to Glidewell. Prior to that, I was doing freehand almost exclusively, reflecting a flap, going in there, eyeballing essentially, and performing the surgeries. The guided surgery is great though. Not only does it allow you to take advantage of cone beam CT scan capabilities, visualizing the anatomic structures, allows you to anticipate if there's going to be a need for a graft, do you have enough available bone, any structures that you need to avoid. It's just a comprehensive thing from start to finish. So the guided surgery has been great as far as minimizing flaps if necessary, if you do the guided surgery, virtually eliminating flaps. The post-operative healing period is certainly much better with guided surgery, I found. And it just gives you a peace of mind that is unparalleled. I mean, if you have that knowledge going in that, where the structures are, where adjacent teeth roots are, the apices, the sinus, the inferior alveolar nerve, whatever it may be, it's just that extra tool there that just kind of gives you that confidence to.
Right, and I think there's something there for not only the person new to placing implants, but also the experienced surgical specialist that using that three-dimensional view and looking and planning everything so you don't have those surprises when you go into it. Sure. Is a key to success, and that's one of the things that we can offer with our service with digital treatment planning, and it ties in cone beam CT, and then there's other technologies we've also been working with too. Maybe you can tell a little bit about intraoral scanning, those types of things.
Sure. One of the greatest things about Glidewell is the opportunity to we get to play with all of the newest, latest and greatest, and certainly cone beam CT technology is a big component of that. We have a Prexion unit that we use. You mentioned about the digital treatment planning service that we offer. Intraoral scanners, I think, are going to be the future. We're moving towards a digital era, certainly, and if we can eliminate the need for impression material, certainly cuts down the cost. If we can, the ability to communicate and upload the images to the Glidewell laboratory right away to get started on the prosthesis, reduces the turnaround time. It's just a much more comfortable experience for the patients overall, I think, and helps to ensure that the best possible product for the dentist and of course ultimately for the patient, which is most important.
Mm-hmm. And I think that leads into, we have, as a colleague of mine says, he calls Glidewell a dental Disneyland because of all the technologies we have here, because any technology that's on the market is literally in production here and in production in a big way, so you sure can get a lot of education quickly. So what leads us then towards wrapping things up here would be another large role you're going to have here with us is running courses at the Glidewell International Technology Center. So maybe you can talk a little bit about that, about how we're going to take these technologies and we're going to help show dentists how they can easily incorporate them into their private practices.
Absolutely. I think one of the great things, as you mentioned, is the opportunity for us to do courses here. Not courses that are going to be designed to make a person, a novice, into an expert implantologist. Again, you want to make sure that you get those comprehensive extended courses prior to coming in, but it's an adjunct and something that they can build on with. For those who feel comfortable doing implants already, those who have proficiency at it and experience at it, this is just a way to streamline everything for them to make things easier for them and the patient ultimately. Again, you mentioned we're going to be doing courses that are going to address specifically the inclusive tooth replacement solution program, so that we can develop that, which I think certainly is going to help the doctors down the road. We're hoping to offer alternatively courses in both mini implants and our conventional diameter implants that we're launching. Courses to familiarize them with the inclusive system and how it can benefit their practice, make it more profitable, make it a much easier, streamlined process again. We're going to have some on cone beam CT technology, the opportunity for folks that may not have access to that or who are kind of on the fence about it to come in and see the benefits that can provide them. I know yourself, you're going to be doing a digital treatment planning workshops to expose folks to that and let them see all the benefits there. So we're very excited about all the upcoming courses and how we can gear those towards general practitioners and specialists alike to work hand in hand with us to improve their efficacy and efficiency, and ultimately do better dentistry for the patients.
Okay, very good. Well, with that, I sure appreciate you having here. Welcome aboard, and we look forward to working with you.
My pleasure.